Hello, welcome to another case study. So, this is case study 28. Okay, so what's the name given to these steps shown above? Okay, so step A, B, C, and D. Then, what is the name of the maneuver at A and what does it look for? Then, 3, what is the name of the maneuver at B and what does it look for? Then, 4, what is the name of the maneuver at C and what does it look for? Then 5, what is the name of the maneuver at D and what does it look for? Okay, so these are very important uh, maneuvers that we usually perform. Okay, then maneuver A, the name of these maneuvers are known as Leopold's maneuvers. Okay, then the name of the maneuver at A and what it looks for. So maneuver A is known as fundal grip. As you can see, the hands are holding on the fundus. Okay, so they are known as the fundal grip, and they assess the uterine fundus to determine its height and which fetal pole is presenting. So either cephalic or podalic. That is, it aims to determine the gestation age and the fetal lie as well. Okay, so determine the gestation age. So the height of fundus in short. Okay, uh, and the fetal lie. Okay, then the maneuver B is known as the umbilical grip. So this is known as the umbilical grip. Okay, as you can see, the hands are usually placed somewhere near the umbilicus. So umbilical grip, and it determines whether the fetus is in longitudinal, transverse, or oblique situation, and determine the position of the back and small parts. So you can determine the position of the back and where the small parts. And this one can even help you for a lot of things, even when putting a fetoscope, at least you know where the back is. Okay. Then, what is the name of the maneuver at C? So the maneuver at C is known as the first pelvic grip. Okay, but depending on the literature, again, you find that other literature will just call it other literatures. So this is the first pelvic grip, uh, or they will just say porix grip. Okay, then it determines the fetal part. It determines what fetal part is lying above the inlet or the lower abdomen. Okay, so that's the porix grip. So that's what it determines. Okay, then we have the last one, which is D. So what is the name of the maneuver D and what does it look for? So D is Leopold's second pelvic grip, or other literature found they just put it as a pelvic grip, but it's best to know that it's best to name them as the first pelvic grip and the second pelvic grip. Then in brackets, maybe that's where you put the porix grip or the second pelvic grip. So the second pelvic grip determines the presenting part in the lower uterine pole. So that's why in the first pelvic grip, other people can even tell you to say, it can even determine the even the engagement under the first pelvic grip. Okay, so that's the end of the tutorial, and this is just some literature review. Though for Leopold's maneuvers, usually there is not necessarily anything more to add on. So it's just an assessment to help you assess the fetal part, fetal lie, if the fetal head is engaged or not, and from there, that's when you can get a lot of information. So one thing I've noticed is that people usually master the pictures instead of knowing where the hands are pressed and what they are trying to assess for. So don't necessarily master the picture. You have to know which where the hands are touching. So what are the hands holding? Okay, what are they touching? Because they might change. Let's say they change C, they put it as D. So they use the second pelvic grip, they put at C, then the porix grip they put at D. So if you can see someone even still putting C, the one for the second pelvic grip they put as porix grip, because because it's like they've just mastered to say A, B, C, D. So follow the hands movement. So what are they, where are they ordering, what are they assessing for? So those are some of the questions that you may want to, some of the things you may want to look out, because under literature review there's really nothing much to talk about. So this is the end of the tutorial, and thank you for watching. If you haven't subscribed, please subscribe and hit the bell notification. And practice makes perfect, so you can practice up on the obstetric Leopold's maneuver, so that you become familiar with the examination, since you are more likely either to be given an unmanned one, or even a manned one. Okay, and you perform this. Okay, so thank you for watching, and like the video, and please subscribe.